Hi, this is Dan Paulson. I'm here to talk to you today about hemorrhoidal artery embolization and how we at Gaston Interventional Radiology perform it and the best way to work your patients up and send them to us. Hemorrhoidal artery embolization is a relatively new but well-researched and effective treatment for bleeding internal hemorrhoids. This primarily is for patients with persistent symptoms that have been refractory to conservative management, or they failed other treatments such as internal banding or surgical removal. The optimal pre-consult workup for referral to Gaston Interventional Radiology would consist of history and physical examination, digital rectal exam, colonoscopy within the last 5 years, or flexible sigmoidoscopy within the last 3 years, and history of failed medical management. However, if you want to send your patient to us and you have a high suspicion for bleeding internal hemorrhoids, we are happy to take that referral and work the patient up from the beginning ourselves. After the workup is complete and we've confirmed that internal hemorrhoids exist and are the culprit for ongoing bleeding, we take the patient to the angiography suite, access the right common femoral artery, the inferior aorta, and the inferior mesenteric artery. After that, we extend our microcatheter down into the superior hemorrhoidal arteries. We deploy microembolic, which occludes the microvasculature feeding the hemorrhoid. After the microembolic is deployed and permanently occludes the hemorrhoid, we then perform coil embolization of the parent hemorrhoidal artery. This causes the hemorrhoids to shrink over time and the bleeding to stop immediately. Here are actual intra-procedure fluoroscopic images of a patient I recently treated with bleeding internal hemorrhoids. You can see my catheter coming up from the right common femoral artery access site. The tip of the catheter is intubated into the inferior mesenteric artery, which you can see beginning to opacify here as I inject contrast. That inferior mesenteric artery leads into the superior rectal arteries, or the superior hemorrhoidal artery on the left and on the right. The distal vasculature of the hemorrhoidal arteries we can see opacify the hemorrhoidal cushions and the mucosa of the rectum. But then eventually we see these large tortuous hemorrhoids. These internal hemorrhoids are what are causing the bleeding in this patient. So now we have a fluoroscopic image showing after coil embolization has been completed. We see opacification of the inferior mesenteric artery distally, as well as the proximal left and right superior hemorrhoidal arteries. The middle hemorrhoidal arteries are still opacifying, and this is depicting how those arteries remain in place, still having the mucosa and the parenchyma of the rectum well opacified, remaining healthy, but we don't see what we saw before, which is these large draining internal hemorrhoidal veins which cause our bleeding in this patient. So this is a successful example of bilateral superior rectal or superior hemorrhoidal artery embolization with the internal hemorrhoids no longer opacifying. As a quick review, the simple pre-consult workup for hemorrhoidal artery embolization for treatment of internal hemorrhoids should include history and physical exam, digital rectal exam, colonoscopy or sigmoidoscopy, and failed medical management. However, like I said before, if you have a patient you suspect has internal bleeding hemorrhoids and you want them worked up, feel free to send them directly to us. What is the easiest way to send your patients to us? We have multiple pathways, one being the traditional EPIC referral order. You can place a referral order with a short phrase as to why you're sending the patient, something like bleeding internal hemorrhoids. You can also go to our website at gastoninterventional.com. We have a button on the website that patients can use to schedule a consultation. It leads them directly to where they can place their name, their email, a short message, and their phone number. You can also, with their permission, put that information and it will come securely to us. Or lastly, if you just want to Volt one of us, that's totally fine. You can Volt me directly, Dr. Dan Paulson, or one of my partners, Dr. Tyler Calise or Richard Herring. Any of us would be happy to help you anytime through these multiple secure pathways. We look forward to working with you and with helping your patients. Have a great day.